IPRO is a non-for-profit Medicare quality improvement organization charged by the U.S. Centers for Medicare and Medicaid Services to improve the quality of care for patients with Medicare. And we're involved in working in many Medicare projects, one of which is to reduce the disparity in lipid and cholesterol testing rates between African American and white Medicare beneficiaries. And as part of our efforts, we've partnered with nursing schools and the New York City Department for the Aging to teach people how to manage their diabetes, mainly in communities, in senior centers, and churches located in communities where there's a large number of African American seniors. We decided to include diabetes classes as part of our efforts to close this gap for many reasons. It's pretty obvious that if you teach people how to manage their disease, that they're going to experience less problems and less complications, and they're going to have better health outcomes.
Well, it's very interesting, and you learn a lot by going out to listen to these programs, really, and the literature that you pick up.
The program has three main components. The first component consists of training the nursing students. Our staff conducts a 6-hour comprehensive training program for the students on diabetes self-management education.
I had mentioned earlier about being visual for this elderly population and to keep them entertained, okay? And we had discussed about showing a plate. And you can buy regular paper plates in the store about this size. You're not looking for the large ones. And you're going to have them draw what the plate should be cut into, okay? Half of the plate should be your vegetables. Okay, this shouldn't be the rice and the pasta, okay? Half of the plate should be vegetables. Then you tell them to take the other side of the plate and draw that half in half, and one portion is meat and the other portion is your starches.
The second component of the program entails the students going out into the community and conducting these diabetes classes.
And what I'm demonstrating today is portions. So if you take a look at your plate, if you take your plate and you mark it down the center, and then you mark out half of one side of that plate. One side is your meat portion, that's 2 to 3 ounces worth of meat, and the other half is your starch portion. And when you do that, you recognize that you have one half of this plate, which we're going to call our vegetable portion, okay?
Another great tool to use is that we literally carry portion sizes on our hands. All right, you don't have to be in the kitchen with measuring utensils. The palm of your hand is 3 ounces of meat. So if they get served in a restaurant this huge portion of meat, they can cut away a 3-ounce portion of meat, and that's the portion size they should be eating. Your fist is 1 cup. Your pinky is a slice of cheese.
And this is how much? 1 ounce. Show me a cup. Put it up. There you go. For 1 cup. Give me something good to put in this cup. Tomato juice.
You're going to teach them exercises sitting in their chair when they're watching TV. You're going to teach them to write the alphabet with their feet.
And write the alphabet with your foot. Start with A and make an A. Make a B. Make a C. On to D. And you're using the foot in ways that you normally don't use it at all. Most people, you just walk and put your foot down.
It's very important that we teach people how to manage their diabetes and what role nutrition and diet plays. We felt it was very important for us to develop a cookbook, what we refer to as a nutritional toolkit, because it's more than just a cookbook. It's a tool that persons with diabetes can use to make healthy food choices about diabetes without having to give up traditional ethnic meals, foods that they are accustomed to eating.
Oh, this is a very interesting cookbook. Oh,
There we go.
yeah.
Here's the whole meal planning thing. Where you can write out each one of the groups you have from meal to meal.
Right.
We've mainly seen improvements in 2 areas. The seniors take an exam at the beginning and they take an exam at the end of the program. We saw more than 10% improvement in test scores. We also saw a reduction in the disparity, almost a 50% reduction in the disparity between African Americans and white Medicare beneficiaries who get this test.
I'm learning that you have to be aware of things. I stay active. I do a lot of walking. and climb the stairs when I can, but moderation. I'm learning moderation.
Through this program, we're reaching people that may not otherwise have access to this. It's been very rewarding.